And welcome you to the 2009 California Conference on Mental Health and Spirituality, and also to this particular workshop, let's see, which is Spirituality and Recovery, What the Research Says. I just want to remind all of you that I will be available at the end of the workshop to sign your sheets for your SEUs. Also, someone will be passing out an evaluation sheet, so if you could please fill that out for us, that would be appreciated. Okay. I want to go ahead and introduce the speaker, the presenter for today. Dr. Lukoff is a professor of psychology at the Institute of Transpersonal Psychology and a licensed psychologist. He is author of 70 articles and chapters on spiritual issues and mental health, and co-author of the DSM-4 category Religious or Spiritual Problem. He maintains the Spiritual Competency Resource Center at www.spiritualcompetency.com. Please help me welcome Dr. David Lukoff.
Thank you, Tracy. Let me just do a sound check. Can you all hear me loud and clear? Okay, then let's start. Well, my talk today, I think, is going to be a little less inspirational than what we've been hearing in the morning. But what I'm going to do is to actually, in some ways, try to replicate what led into this major shift that we are seeing today in the attitudes towards the relationship between spirituality and mental health, really spirituality and healthcare in general. And it's been this kind of convergence, almost a perfect storm that has been occurring between the consumer movement, which I'll talk about in a second, that has been a grassroots, bottom-up movement, as was mentioned this morning, that has involved some of the people who are at this conference, in fact, and you'll hear one of them tomorrow, Jay Mahler, along with a well, I was going to say resurgence, but really it's all relatively new, research on the health benefits of religion and spirituality, which is relatively recent. I actually did a review of all of the literature on spirituality and mental health back in 1990, and I was able to fit everything that was published in 2 articles. Now, there was just a book published about 5 years ago that reviewed 1,200 research articles and was about this thick. And that's already, I'm sure the amount of research in the last 5 years has doubled that. So I'm going to talk a little bit about the consumer movement and that part of the storm, and then I will switch and give the kind of talk that I've given at medical schools, psychology departments, grand rounds, and so on, that tries to persuade people, and I think I'm preaching to the converted here, because you're all here at this conference on spirituality, but when I've given talks at grand rounds, I've literally had the experience of being introduced with my title and people realizing what the topic was, having just routinely come to the grand rounds every week. This happened at UC Irvine, for example. And as soon as they hear it's on spirituality, they fold up their lunch and walk out. So that has really been more characteristic of the reception that mental health has had towards spirituality for quite a while. So let me just share a little bit about the consumer movement. And I'm going to start with a quote. And this is from the person we'll be hearing tomorrow, Jay Mahler, talking about his experience with bipolar. For me, it has been a spiritual journey, regardless of what anyone else chooses to call it. That's what it's been for me. The whole medical vocabulary to describe what hit us brings with it a new set of conflicts and disturbances that mental health professionals don't address. But as they go through trial and error, looking to see if anything they have to offer works at all to control your symptoms, it doesn't take a genius to realize they haven't got the answers. No clue about cures. And oh boy, those side effects. I don't say medications can't help or that treatments won't have value, but what I do say is that my being aware that I'm on a spiritual journey empowers me to deal with the other enormous parts of the puzzle, the big human spiritual questions, like why is this happening to me? Will I ever be the same again? Is there a place for me in this world? Can my experience of life be made livable? If I can't be cured, can I be recovering? Has my God abandoned me? Bottom line is, as a victim of whatever it is they see that we who have it have to wonder whether what remains constitutes a life worth living. That's my spiritual journey, that wondering. That's my search. That's something I must do. I first met Jay at a conference where I was quoting him, and he came up afterwards and said, "I'm Jay Mahler," and that was the first time I met him. So let me talk about the consumer movement. And, whoops, that's not what I wanted to do. And actually, Sally Clay over there was one of the early leaders in this movement, and I'll talk about what's on the slide in a second. But let me just recap the 40-year history of this movement briefly. And you have a little more expanded version of that in your handout materials, it's not a loose leaf, that bound book you have, in an article that I wrote with Jay and with Laura Mancuso, who you'll also see tomorrow, that recaps the history of the Spirituality Initiative here in California and also the consumer movement. So it really started in the 1950s. That is, I'd say, the inspiration for it started in the 50s with the civil rights movement. And as I'm sure many of you know, that really created a enhanced consciousness about issues of inequality and social injustice. It triggered the women's movement, the disabilities rights movement, the gay rights movement, and also the consumer movement. Now, when it really started in around 1970, the consumers actually referred to themselves as ex-inmates often. Survivors was another term that people in that movement used. It was labeled the anti-psychiatry movement by many of them. And it, for example, Sally Clay, as part of that movement, formed an organization in Portland, Oregon, called the Network Against Psychiatric Assault. So the first birthing of this movement was very polarizing in that sense, that it was really focused a lot on the way people had been mistreated. But interestingly, the National Institute of Mental Health started to work with this movement and actually sponsored conferences for consumers to meet with mental health professionals, administrators, and so on, so they could be in dialogue about these issues. And initially, I don't think spirituality was a main concern at all. But starting in the late 70s, in a few different places, there popped up some spiritual support groups. Jay Mahler and Frank Leonard, who some of you may have heard of, started one in San Francisco, and there were a few others in other places. And in the 1980s, 1993, the National Institute of Mental Health held a conference called the Alternatives Conference, which was titled A Celebration of Our Spirit, which was the first time that the whole issue of spirituality and mental health was explicitly addressed in that way. And then it was followed by a few other conferences, including a 2004 SAMHSA conference that also addressed these issues. In 1998, Gunnar Christensen founded FaithNet as part of NAMI, which then brought in another stakeholder in terms of being concerned about the importance of spirituality. So that's a thumbscale picture of what led up to, I think, this support within the California Department of Mental Health and county mental health systems for addressing spirituality. So let me mention about Sally Clay. Sally Clay wrote an article back in 1987. It was called Spirituality and Stigma. And I think of that as really one of the classic articles in this field. And one of the things that she did was go back to the Hartford Institute of Living, which is a Yale Medical School affiliated psychiatric hospital, where she spent 2 years. And she looked at her records to see what was in there. What had they reported and documented about her 2 years at the Institute of Living? And what she wrote is that not a single aspect of my spiritual experience at the Institute of Living was recognized as legitimate. Neither the spiritual difficulties that in her mind had triggered it, nor the healing that occurred at the end. And one of the things that she did at the hospital was start to go to religious services. And she went to the Catholic service, the Protestant denominational services, the Jewish services, and she said if there were Buddhist services, she would have gone to them too. That was the environment where she started to first connect to healing. And so then she writes, for me, becoming mentally ill was always a spiritual crisis, and finding a spiritual model of recovery was a question of life or death. So I think she was one of the first people to put this perspective in print. Now, this is what why it was such a challenge for the system to accommodate a view like that. This is our good Dr. Freud, who has to be given a lot of credit for creating the idea that talking about problems can actually be helpful. That's a pretty radical idea back in the turn of the century, the talking cure. It's still something we, as a profession, support and believe in, but he had a real issue with religion and spirituality, and in fact wrote a whole book defining religion as a system of wishful illusions together with a disavowal of reality such as we find nowhere else but in a state of blissful, hallucinatory confusion. And in some of his private letters, he actually even talked about religion as the enemy. And a little bit of that was the birth pangs of the whole field of psychology and psychiatry, which was in the process, starting in the 1880s, of separating from philosophy and religion. That's where mental health issues had normally been discussed. Things like depression, the dark night of the soul, that was a theological issue. So part of what he needed to do, he felt, was to really make a very clean break with that. But it involved clearly pathologizing religion. And Albert Ellis, who many of you know was the founder of the cognitive part of cognitive behaviorism, had a similar perspective. Spirit and soul is horseshit of the worst sort. Obviously, there are no fairies, no Santa Clauses, no spirits. What there is human goals and purposes. But a lot of transpersonalists are utter screwballs. And I happen to be the president of the Association for Transpersonal Psychology, so I'm a certified member of being a certified screwball, I guess. Transpersonal psychology, though, was the branch of psychology that in the 1960s started to take spirituality seriously. It was during the time when a lot of the Asian techniques, meditation and yoga, were starting to come into the United States, also psychedelic drugs, and people were having experiences that were off the charts. They were not understandable from a conventional behavioral or psychoanalytic perspective, and the people who really wanted to take that seriously and study that really had no place to convene and hold meetings and publish on these kinds of topics, so they broke away from the mainstream of psychology and formed the Association for Transpersonal Psychology. So even in my own career, when I started to develop an interest in this, I was clearly told when I was at UCLA that this was not going to be helpful in my career. And I spent 5 years on the faculty at UCLA, and they convinced me that this was not going to be the right place for me to pursue a career with an interest in spirituality and mental health. And I left, and I came up to the Bay Area, and I've been now working at the Institute of Transpersonal Psychology, which is clearly much more open to that. However, at UCLA, there is now a very well-endowed Center for Mindfulness. So, in fact, I think the tide has turned, and even places like UCLA and Harvard and all the mainstream places now are really much more open to it. And in fact, much of my talk today is going to be discussing what changed the perspectives of the mainstream. Okay, but as I say, this was where it started. I'm going to take questions, not at the end, but let me get a little ways through this, and then I will. And B.F. Skinner had a similar perspective. Religion is an explanatory fiction of a miracle-working mind, and prayer and other rituals are superstitious behaviors perpetuated by an intermittent reinforcement schedule, which those of you who have a little training in behaviorism know that what that means is that if you pray a lot, for example, every once in a while, by chance alone, something you pray for will happen. And that is random, but it's going to reinforce that behavior. So that's the perspective from the founder of the behavioral school. So we have the whole psychoanalytic school, the cognitives, and, pardon? Psychoanalytic, cognitive and behavioral, having a highly negative view of spirituality. And of course, many of us, there's still echoes of that in many schools and many training programs, I think. And you can go, like I did, to many conventional graduate schools, and Jung is not even mentioned. But you're right, absolutely right. He was much more amenable and open and actually explored the spiritual domain. So, a cartoon. Freud looking at the meditating Buddha here. Overprotective father displays obsessive-compulsive behavior patterns, possibly catatonic. And in fact, if you look at the literature on meditation up through the 1970s, it was frequently described as a state of artificially induced catatonia. Because if you just look at somebody who's meditating, they look impervious to the environment, just like a catatonic person would be. But if you talk to the person about what they're experiencing, it's a whole world different. So you actually have to explore it in a different way than the way the Western empirical scientific approach is used to doing, to understand the benefits of it, which we now do. Okay, this is what I think radically changed the perspectives of the mainstream. And this, I'm going to elaborate on this, but the substantial empirical data, I mentioned 1,200 studies 5 years ago, probably at least 2,000 by now, show pretty conclusively, like 85% of the studies show significant preventative effects for mental and physical illness, for improving how people cope with mental and physical illness, and for facilitating recovery from mental and physical illness. And now I'm going to talk a little bit more about some of the specifics, studies. And I've I want to just acknowledge that there were a number of people doing what I'm doing right now, which is presenting this research to try to make the case for the importance of addressing spirituality in healthcare. And there's actually a person who I think was far more responsible than I was for this, and his name is David Larson. Unfortunately, he died at the age of 54, but he had his tray of slides and flew around the country giving talks at medical school after medical school, grand rounds after grand rounds. He also made his slides available so that people like me could take a look at what he had done and actually use his slides in presentations. And there's a few of my slides which actually come from David Larson. So I just wanted to acknowledge that. I think another inflection point in this was the fact that in 1994, the DSM acknowledged that people can have religious and spiritual issues that affect their well-being, that can cause problems as well. We're going to look at the positive health benefits, but it's also important, this was an important step to basically say to the entire field of mental health that it is important with some of our clients to address religious and spiritual problems that they may have. So let me go ahead and read this definition. This category can be used when the focus of clinical attention is a religious or spiritual problem. Examples include distressing experiences that involve loss or questioning of faith, problems associated with conversion to a new faith, or questioning of other spiritual values which may not necessarily be related to an organized church or religious institution. So what that has meant is that every single psychiatric residency program now has to provide training in religion and spirituality. And when the APA's residency accreditation committee comes around to residency programs, they actually look for this. So that has also been a point at which things started to change too. So if you look at the early literature on spirituality and mental health, especially with serious mental health issues like schizophrenia, the predominant perspective, and I was trained in this when I was an intern at Camarillo Hospital, was that religion and spirituality, especially for patients who had any issues in their delusions or hallucinations around religion and spirituality, that talking with them about these issues would only reinforce their delusional, the strength of their delusions. And that's what I was in fact taught and trained to do when I was an intern at Camarillo Hospital. There was a code for that. When a patient started to talk about religion on the unit, you were to immediately break eye contact and proclaim in a loud voice, "It's snowing in Bakersfield." And this was a secret code to the rest of the staff that that patient was to be put on extinction for the next half hour, which extinction is a polite word for punishment, basically. But the idea was that you were to withdraw all attention, which is presumed to be rewarding, from them for just talking about religion. And they were also deprived of any of the token reinforcers as well, cigarettes, coffee, blah, blah, blah. So that also shows you how dated this was. Cigarettes were used as reinforcers. So this is from an early review of the scientific literature that found that the notion that religion exerts a negative influence on mental health in patients was not generally supported by our findings. In fact, a meta-analysis of religiosity and mental health found them to be positively related. Well, what a surprise. I mean, this was really, I mean, I think people who were doing things like developing programs to put talk of religion on extinction were sincere. They were really they really believed, a la Freud, that by talking about religion, you were just perpetuating the hallucinatory belief system. And what you wanted to do was to get that patient to be talking about, you know, reality-oriented things like the weather and what they had for lunch and things like that. But the data does show them wrong. Another more recent review of the literature, and this was in that book I was referring to that was about this thick, that reviewed every research study that had been produced up to that time. So they asked the question, can devout religious beliefs contribute to the development of schizophrenia in persons who already may have limited capacity to adapt? Because again, that was, I would say, the dominant belief in the field. And the conclusion of the based on the research is there's no evidence about causality. However, schizophrenia may be characterized by a certain type of hyper-religiosity. That may be true, but that there's no downside to that, basically, is what they're saying here. And in fact, the same person went on in a review to specifically on research on mental illnesses to say religious practices such as worship and prayer appear to protect against severity of psychiatric symptoms and hospitalization and enhance life satisfaction and speed recovery in mental disorders. In fact, when you look at the whole picture of the impact of religion on health, you can actually make the statement that infrequent religious attendance or poverty of personal faith, I don't know if I would say should, but could be regarded as a risk factor for morbidity and mortality that is nearly equivalent to tobacco or alcohol abuse. I don't really like the way that is said, but the point, I think, still stands, which is that the benefits to a client of, for example, joining a spiritual group, and here I would include AA as well as organized church groups, is has as powerful an effect as on their overall health and well-being as would giving up alcohol for an alcoholic or stopping smoking. If you just look statistically at the health benefits of, say, going to church, it has that level of impact. So I'm going to show some more, but let me just take a break and see if there are any questions. And I believe you had a question there.
Yeah, well, a couple things. One, he had Ellis up there, and he was saying something, I can't remember the exact statement, there's no spirit or something like that. But we also noticed that Ellis didn't provide any actual evidence or research to make that statement. You know, he's a bright, respected guy, so he throws it out there, so everybody bites on it because he's out of Ellis. That was just one comment. And that related to the fact that my own family, and I'm a licensed clinical social worker and very intelligent, blah, 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 you know. But in the last year, when my mom died, it started bringing the family together. And so a statement from her brother, and I'm in a family of people who lack faith, the statement is, well, we know you went off the deep end. So that whole belief system about religiosity is pathological. Whereas you're saying research showing it's a strength that we have that maintains our mental health. And so that's all I want to say, because that's the thing about me is when people make that statement about about faith, they always make that statement without any evidence to back it up.
Good.
You know, it's just, and so I say, well, where's the evidence that you have for that statement? And they kind of go, because all they're doing is recycling it. And when you're talking about Camarillo, because I used to work in mental health in the Girl Valley, and our patients would go up to Camarillo back in the 70s. They didn't talk about religiosity with the patients because they weren't trained.
Yeah.
do it. And so what they were just doing was they were passing down bad practices.
Yeah.
You know, and because, you know, I'm uncomfortable, it's a whole countertransference issue. I'm uncomfortable with my face, so therefore I'm not going to talk to you about it, or I can't even see anything valuable in it. So,
Yeah.
you know, it's just kind of institutionalized malpractice.
Excellent point. And yeah, please make comments as well as questions like that gentleman just did. And the point about training, I think, is critical. I think you're absolutely right that even well-meaning mental health professionals often just feel incompetent. They haven't been provided the training to know what to do if a client, in fact, brings up religious and spiritual issues in any form. And one of the arguments that the three of us who made the proposal for that DSM category generated to the American Psychiatric Association's task force on DSM-4 was exactly that. First, we cited a number of surveys showing how frequently clients bring up religious and spiritual issues in treatment, and it's very high. It's at least 1 in 6 bring up specific religious and spiritual issues, and 70% will use religious and spiritual language in describing difficulties that they have. Then what we showed is that almost no, I mean, we were talking about like 0% of psychiatrists at that time, and about 10% of psychologists. There are a few religiously oriented graduate schools like Fullerton and so on, where they do provide some training in this, but that only such a small number have been provided with any resources, any training to be able to deal with these issues. So that was one of our arguments for the need for a category, because that would then mandate that psychiatrists, psychologists, social workers be given at least some training in how to talk to clients about these kinds of issues. Yes, sir.
Yeah, I think there needs, after 15 years, I think that the people that are bipolar or schizophrenic that frame their mental illness and their struggle in terms of the spiritual warfare have a vocabulary that they pretty well honed, that most of us mental health workers don't use, don't accept a lot of times, and they say something of religious nature 2 or 3 times and then they're dismissed as hyper-religious, and that's the end of that part of the interview.
Correct.
Instead of trying to get them to verbalize it in the context and trying to understand. But then you have to have the language to do that, to ask the questions in an intelligent way. Just like the person that's been suicidal can talk to someone that is suicidal about where those thoughts come from.
Yep.
You have a vocabulary.
Yep. Well, I wasn't going to really go into this, but my presentation tomorrow, I will talk about my personal experience, which was having an episode where I believed myself to be a reincarnation of Buddha and a reincarnation of Christ. I spent 2 months writing a holy book that I thought was going to change the world. I literally went out into the street, handed out copies of this book, and was very lucky in that during this time, my friends provided me with room and board, shelter, companionship that allowed me to go through this experience without being medicated, without being hospitalized. And then, in fact, I went into Jungian analysis because I wanted to know, how did this Jewish boy, who, came from a fairly secular background, we were never members of a Jewish temple or anything, all of a sudden think that he was a reincarnation of Buddha and Christ. And I really needed to find a way to understand that. And I really then, my career is really oriented towards providing a lot of that kind of support and solace to other people who are having similar experiences. Even people who have diagnoses of schizophrenia and bipolar disorder, I think, can benefit from this kind of exploration of the meaningfulness of these kinds of experiences, even if they're on medication, even if they need their medication. Those kinds of experiences can really be the foundation for an active spiritual life, and that has really not been acknowledged until recently. Yeah.
There's a piece of literature that we shared in our department from third world countries as opposed to first world countries. And I'm guessing he didn't mention the first world part, but just that it was more that it had been more successful in third world countries. And I'm guessing the reason behind that is that in third world countries there's probably more of a unity as far as being on the same wavelength as far as their spiritual beliefs or somewhat connected. Whereas, say here in the U.S., there's a very diverse population with a very diverse religious belief system, and so I don't know if you wanted to maybe say anything on that.
Well, I'll say one thing.
Take on that.
Yeah, you know, you're bringing up a very interesting area, and Mark is certainly a pioneer in this. It's a tangent, but I'll just mention it quickly. In Belgium is a town called Geel, G-H-E-E-L, and I've seen a documentary on it. And it's a place kind of like Lourdes, where people go to get healed, but in Geel, the place that they go to get healed is known for healing mental problems. But I don't know if this is what happens in Lourdes, but sometimes people would come, their families would bring them to Geel, they wouldn't be cured, and the family would leave them there. So the church actually organized a community support system for these people, and funded, now the government funds it too, actually, but the church would pay families to take these people in. And they have a really model system of community integration as a result of that. And it was really initiated by the church there. Okay, we'll have time for more questions. So again, this is, you know, a lot of research that I'm throwing at you, but Roger Fallett, who was one of the keynote speakers at the Northern California conference, I don't know how many of you knew that for Monday, 2 days before this conference, there was a similar conference held up in Northern California in Alameda. And Roger Fallett was one of the keynote speakers there. And he conducted some research that showed the following. Spirituality played a positive role in coping with stressful situations. Specifically, prayer and reliance on religious role models helped avoid drug use and negative activities. Church attendance and a belief in higher power provided social and emotional support. Spirituality enhanced the sense of being whole. And that, if there's any one thing that I've heard over and over again, it is exactly that. That, you know, what the word schizophrenia means like split mind. I don't think that's scientifically accurate. There's no split in the brain. However, it is phenomenologically accurate. People really, when they have a severe problem like schizophrenia, often do not feel whole. And spirituality can be one of the routes to recovering a sense of wholeness. I think another interesting factor is that even without the input of the mental health system, many consumers on their own are turning to religion and spirituality. So 50% in this sample engaged in religious spiritual reading, which could include the Bible, but it often, in my experience, includes many of the best-selling type books by Deepak Chopra, The Road Less Traveled, you know, many of the books that I'm sure many of you have read too. 31% engaged in some sort of meditation practice, and 20% even were trying yoga. In a survey of consumers, 83% felt that psychiatric beliefs had a positive impact on their illness through the comfort it provided and the feeling of being cared for and not being alone that it engendered. And interestingly, and there's been I should update this slide because there's actually been over a dozen studies now showing that meditation has beneficial effects even with serious mental problems like schizophrenia. One of the things that I did at Camarillo State Hospital was to run a program. This was actually my doctoral dissertation there, which included meditation, it included yoga, it included art therapy, daily exercise, groups that were called Growth Through Schizophrenia, where I would bring in accounts of Native American vision quests, where people go off on their own and fast, meaning they don't drink water and they don't eat for like 4 days at a time, which will often induce visions. In fact, they're trying to have a vision in order to, it's done in adolescence as a rite of passage, but it's also to help them have a vision for their life. What is their role going to be in their tribe? But they have very bizarre experiences with a lot of animal imagery and things like that. So I would share that. I shared accounts of shamanic initiatory crises where people often have an ascent up into the upper world, kind of like heaven, and meet divinities, and we'll have a descent into the underworld where they'll be encountering demons and be dismembered. And then often the imagery includes having all of their bones boiled in a big pot and then being reassembled as a new person. I would share that. I shared the artwork of Vincent van Gogh and asked what similar visual experiences people had, to try to give a positive kind of reframe to some of these experiences they had had, and to also explore what meaning that could have for them in their current life. Actually, I've had the opportunity to present on some of these things in the UK, because in England and Scotland, I haven't been to Ireland in this regard, but in England and Scotland, the National Health Service has adopted mindfulness throughout their entire system of as a way to deal with both mental and physical problems. And it's taught to consumers with not only depression, where the research is compelling and overwhelming, really, but also with consumers with diagnoses like bipolar and schizophrenia. Okay, this is an interesting finding. With a group of patients who were hospitalized, as I recall, this was like their first hospitalization, and then they were followed up every 6 months for 2 years. And 30% of these consumers reported an increase in religious faith after the onset of their illness. And this finding is similar to what we find with other people who have other kind of catastrophes in their life, like parents who lose a child. There's a percentage of them, around a third, where it actually increases their faith. It also should be acknowledged, and if you remember, this was listed in the DSM-4 category, that it can also lead to a loss of faith. It can also lead to people feeling abandoned by God, or questioning whether there is a God, and so on. So that can happen too, and that I just want to acknowledge that. But it's also true that for many, it actually increases their faith. And 61% reported that they used religion to cope with their illness and to get better. So another point that I think is important here is that many consumers report, this is on a survey of religious needs, the need to go to church, the need to talk to a religious professional, the need to participate in rituals, but it was a whole list of these kinds of various religious needs. 88% of psychiatric patients reported 3 or more current religious needs. Yet, the psychiatric patients had lower spiritual well-being scales and were less likely to have talked with their clergy. Conclusion: religion is important for psychiatric patients, and they may need assistance to find resources to address their religious needs. And that's really, I think, one of the themes of this conference is how can we bring together these inherently supportive networks of faith communities, the mental health system, and consumers and families of consumers together to start to address the existing spiritual needs that consumers have. Okay. Well, let me take a break and see what kinds of questions we have. Yes, sir, in the back, all the way.
Dr. Lukoff, back to your meditation. So are you encouraged by the findings about neurological plasticity and actually repairing the damage or fragmented parts of the brain through meditation through yoga throughout this?
I absolutely am very encouraged by those findings. There's a similar finding that psychotherapy, not 3-session psychotherapy, but longer-term psychotherapy also affects the structure of the brain. So I think even for conditions which clearly have a neurophysiological correlate, we know there are neurotransmitter imbalances in the brain with people who have depression and bipolar disorder, but I think it is also very possible, and I'm trying to be conservative in how I state this, but I think it's very possible that practices like meditation and Tai Chi, which include mind-body coordination in a spiritual context, can remediate, can repair the brain. I can't say that conclusively. I actually have not seen a study that absolutely documented what I just said, but we do know from the neuroplasticity studies that the gentleman mentioned that the brain is very plastic. It is very changeable. So we know that there are depressogenic styles of thinking. Well, if a person engages in depressogenic thinking, they can alter their neurotransmitter balance. And even Jung, he has a whole book that he called The Psychogenesis of Mental Disease. So his point is, in that very title, that, yeah, there are, the word disease implies physiological change as opposed to illness, which is more subjective. So there can be physiological changes in the brain as a result of, or that accompany mental problems, but that's a chicken or egg issue. We don't know whether the person brought on their psychotic problem, their depression problem, through various styles of thinking, behaving, drug use, healthcare habits that were dysfunctional, or whether it's exclusively genetically driven. The likelihood is there's some of both in there, and that there are some people who might have such a heavy genetic loading that there's very little they can do. We can improve their well-being, perhaps, by changing health habits and helping them to learn these practices. There are other people, and I've worked with some people with bipolar disorder who have been able to get off of medication by changing their lifestyle, by learning these kinds of meditative practices and so on. So I'm optimistic about that. Yes, ma'am.
Yeah, I have a question. When you mention religion here, there are a lot of different religions. Are you talking about any specific religion, or does this study all religions?
You know, I've never seen anybody break that down. The question was, when the term religion has been used in many of the studies that I've cited, have they ever broken it down into specific religions? And I've not seen anybody do that. In fact, the most common measure that is used in this area is attendance at church. There are now several good spiritual well-being scales that look more at our intrinsic spiritual outlook on life. But the most common measure that's used is just religious attendance, and they don't look at specific denominations. Yes, ma'am.
Dr. Lukoff, I have a question. You mentioned about how could you integrate the community, and with my studies and studying theology and psychology, and knowing that actually the mental health and people with mental health issues is actually served by theologians and pastors and
Mm-hmm.
that's exactly of how they were served. And from your research, you know, I was looking especially before the 1700s. And as I look at the progresses of psychology and actually making it a science, that's when I saw that that the integration of spirituality was not too much talked about as heavily before it became a science. So in that, when we're, you know, it's like there's not anything new thing under the sun. Actually, this movement is going back to the original methods of actually of how patients or people, just people, period, that who were depressed or stressed, and who were their first responders. And it was actually in theology. It was your rabbis, and it was your pastors. Martin Luther did a great job with it.
Mm-hmm.
It was the movement of the Protestant movement. So in that, when I read the information and the research, and by me, you know, like Azusa to research that, I don't see a lot of that truth in the findings when we read our books in psychology.
I agree. There's no acknowledgement in psychology that I've seen that it has deep roots going back through Judeo-Christian religion all the way back to really shamanism. You know, what is really being a healer about? And I think it elevates our the role of a mental health professional to see those deeper roots that have been ignored. Thank you. You have a question back there?
Yes. I think your slide here, the conclusion.
Could you speak up just a little bit, please?
The slide, the conclusion stated in the slide, I don't know if that's yours or the researcher that's cited there.
The
but
researcher.
Also the theme of this entire conference seems to be to promote that connection between the spiritual experience, right, obviously in mental health. So I guess my concern or my question is in the difference between spirituality and spiritual experiences that can be beneficial in this manner versus those more institutionalized religious sort of experiences that have often resulted in trauma for many individuals. And so as we move in this direction, it looks like even policy is advocating for this. How can we safeguard and prevent in the same way that we have, well, I know that the psychiatric experience could be seen also as something that is very oppressive for many people, but the experience within organized religion has been quite devastating for a lot of ethnic groups as well as perhaps even individuals. So how would we deal with that?
Yeah. Well, thank you for bringing up that point. I do have a couple of slides that actually look at harmful forms of religion, and I think that has to be acknowledged. And I know in my own work with the dual diagnosis program, when I was working with the clients around their connection to a higher power that was so fundamental to the 12-step, because I found that about when I remember that day sitting there talking to them about their connection to a higher power, and half the people in this group of about 10 said that they really didn't have any experience of that. And so then we started to explore that, and many of them had religious wounds, experiences that had really traumatized them in various ways. So I think that has to be acknowledged, and I think we need to actually take that into account. And I know in my own work, and this is what I've tended to recommend to people. When I work with a religious professional, and I worked with the Jewish rabbi who was the chaplain at Camarillo, and I worked closely with the Lutheran minister who was the chaplain at the VA, I got to know them before I started to work together with them or tell patients to go visit them. So I think it's, you know, something in the 12-step area, you have to be careful about referring people to church groups or religious professionals who would, for example, advise them to get off their medications and stuff. So there are these kinds of areas. It's what makes this an area that is very complicated, I'd say. It isn't going to be a simple thing like we just need to get religion. We have to be careful about how we incorporate religion into healthcare in a way that promotes well-being. And there is starting to be some research on that. And I have one, I will get to at least a little bit of that, but it's an important point. Yes, sir.
If I may, I would like to be the devil's advocate for continuing what the lady was saying. When we talked about Freud and Ellis and Skinner, I think what they were talking about is more like the product of the Western world religion, the organized religion, and which is not very far from Karl Marx's, you know, when he said that religion was the opium because it would dull the minds of people. So maybe they too were victims of bad religion. I don't know, what is your take on that? Good.
You know, I don't know their personal histories enough to actually comment on, you know, Freud or Albert Ellis's specific upbringing. But yeah, I think you're bringing up kind of the same issue about, you know, we're not really saying, you know, you can just write it out like a prescription, you know, you need religion. This is an area where you have to get to know the client. You have to get to know what the client's religious values are, what their prior religious experiences are, and then it becomes a joint exploration with them about, well, how can they get, you know, some meaning in their life? It may include a church or a spiritual group. It may not. There are definitely people who are very healthy, mentally and physically, who are not members of a church, who don't meditate, and so on. But they have other sources of meaning. I have a good friend who's an adamant secular humanist. He is also a person who has done major acts of citizen diplomacy. He has been, I would describe him as a very big-hearted person in numerous ways. I look at him as a very spiritual person. He would groan and object if I applied that adjective to him. So I think we're also using spirit, and I didn't go into the definitional issues, but I think how I would define spirituality is a big enough umbrella that it really can include sources of meaning and purpose that really do not touch on religion in any way. So I'm not really advocating it specifically. Yes, sir.
I have kind of a comment and a question. When I was a child, I had a friend of mine do me a great disservice by allowing me to go to church with him as well as fire and brimstone churches. And because I didn't believe their doctrine and I didn't go to their church, I was told I was going to go to hell. And as a young child, that kind of scarred me. My question is, how do I go about finding a higher power now that I can believe in? I have COD issues. How do you go about finding a higher power you can believe in?
Well, I think by participating in activities like this, where you explore it, you hear how other people have integrated spirituality into their life. Maybe some of the displays out there are possible avenues to explore. I like the word spiritual journey because it really connotes that it's a lifelong process of exploration, and it's hard to say where it's going to take any one individual. And that's the attitude that I think those of us who are in the role of being a mental health professional have to approach it, that it's that client's journey. You know, we can be a support on their journey, but we really don't know, you know, where that journey will take them. Yes, ma'am.
For patients that are, let's say, atheists or agnostics, for example, but we know that spirituality and religion can help a lot of patients recover, would it be too overwhelming to just bring up like a popular notion, for example, angels, and how the rabbi earlier spoke about angels? You know, that's a very popular notion, even though presenting something as simple as that, saying there are angels that can support you and help you, or something to that effect. Or what do you think about that, the angels?
Yeah. You know, I would be hesitant to pick out any one thing and mention it, but I certainly, you know, try to kind of play off of what I'm hearing. And I do, and we don't have, we won't even have time to do the mini version that I was hoping we would today of a religious and spiritual history. There's a version called the FICA. I'll show you the slide later. But there's also a more complete exploration of, for example, what have been powerful experiences of meaning in that person's life? Have they ever felt connected to something larger? Have they ever prayed? It becomes a first. I think the very first step that I would do with a client touching on this area of exploring a higher power is to get a history in this area and just to see if there's anything that they've had from their childhood that maybe they haven't pursued since, but that was meaningful at the time. Maybe they had, unlike you, an experience of going to a friend's church as a kid that they actually liked, but that wasn't their family's church, so they never went back. You know, it becomes an exploration. And I think, you know, I do sometimes share what I've done, because I came from a agnostic background, and I've dabbled in lots of things. I've gone to meditation retreats. I've joined a number of different spiritual groups. I've dabbled in yoga, Tai Chi, Aikido, the martial. It's kind of a spiritually oriented martial art. I've been doing that for 19 years. That one stuck with me, but I've tried a number of them. So I think that's part of the process of being on a journey, is you give yourself permission to try things and see what is meaningful for you. And the research doesn't support one over the other. Yes?
I would just, we'll raise a question here that despite, if there's research that indicates that the more times people who go to church more often are either mentally or physically healthier, or people who use prayer or pray more often or more physically. Trying to interpret one of the slides you had up there, but it seems to imply that. I don't think you can conclude that someone who is atheistic would have their life improved by helping them gain religion. I don't think that's a logical conclusion from those data, because most of the people in those studies presumably were religious, and the more they practice their religion, the better off they seem to be. But that doesn't mean that someone who's not religious would be better off if they were religious. And I think if a therapist decides they're going to help someone become religious, they may be overstepping a boundary.
Absolutely. And that's a very important point. And it's not something you can just prescribe, like this is going to be good for you. But I do think it is, you can certainly start with, what gives you meaning in life? What gives you a sense of purpose in life? And see where that goes. For people who are in a 12-step program, that's a little different for me. It feels to me like if they don't get connected to the sense of a higher power, the 12-step is just, you know, paying your dues or going because you're required to by a program. Now, of course, there are other programs like rational recovery. And I have had, when I was at the VA, somebody who just said, I want nothing to do with religion. I've had bad experience. I think it's all a bunch of bull, et cetera. Then I've explored with them alternatives to the standard AA approach. So absolutely, I would think that's really unethical to tell a client that they should go to church, they should get religion. Let me just mention this, and I just want to go back, and we'll hopefully have a few more minutes for questions. So, this is an example of the way in which religious beliefs can be problematic. This is a sample of 52 seriously mentally ill patients, and 23%, almost a quarter of them, felt that their illness was a result of their sins. By the way, this is not just in mental illness. People who develop conditions like life-threatening forms of cancer and things like that, also about a quarter of them entertain the idea that this is a punishment from God for sinning. Pargament is a researcher who has looked at different styles of religious coping. You know, many patients do turn to religion, but as it's turning out, some ways of turning to religion to cope are actually dysfunctional. And so he identified 4 kinds of coping: self-directing, where the individual sees themselves as the focus of action and responsibility; collaborative, where a person works hand in hand with God to solve a problem; deferring, the person turns the entire situation completely over to God to solve the problem; and pleading, the person requests God's direct intervention to bring about their desired outcome. And based on the research, I'll quote, "The results underscore the value of a collaborative method of religious coping. The sense of control derived through a relationship with God appears to be especially helpful in this critical situation rather than through self-directing or through only God, that is, deferring or pleading." And I didn't put the slide in here, but what he actually found that led to this is a higher rate of mortality and morbidity amongst those patients who held this belief that their illness was a result of sin. And we already know that people with a diagnosis of schizophrenia have a really lowered expected lifespan, like 25 years lower. And my guess is that holding these kinds of beliefs can be a contributing factor to that. So, here are examples of these kinds of harmful forms of spiritual coping: feeling anger at or abandoned by God, feeling illness as a punishment for sins, believing illness is the work of the devil, and religious conflicts with dogma, congregation, or clergy. In contrast, helpful forms of spiritual coping: perceiving God as a partner, viewing illness in a larger context of meaning, participating in a supportive religious network, experiencing spiritual connection to the transcendent, and redefining ultimate values and priorities. So I think that's all the slides I'll show. We have 5 more minutes, and the comments and questions have been so good. Let me just continue with that. Any others? Yes, sir.
I shared your concerns about the issues of religion, how that impacts people. Growing up in a family that was basically very anti-faith, but it's very easy to throw the baby out with the bathwater and assume this toxic nature of religion. And that word right there really gets a lot of people in difficult circumstances, because we define religion based on relationships. When I see statistics, you know, and I think about all the abuse, sexual abuse in the Catholic Church, having worked with a lot of abuse victims, I know that genesis comes from that abuse in that family, or being victimized, and never really getting healed from it, and it just grows. And so, for me, you know, part of my early training was just, it's about the relationship. A lot of times you don't have to have a PhD. You have to have this caring relationship. That's really what works for people. And if people have relationships with the religious people, then they reject religion.
Mhm.
But what they, in terms of them getting healed, they need to, you know, develop therapeutic relationships, and they need to be discerning about where they go. I'm a recovering drug addict, alcoholic, and is very much anti-faith. But the 12-step programs will help me to build that slowly but surely. And how did that happen? By these relationships with these people. And our mental health profession is, the statistics for helping people with drug and alcohol problems is just terrible. You know, but the statistics coming from the 12-step programs, which are spiritually based, are very, very good. And the reality of it is, how does it work? It works because not only developing the faith, but also the relationship. And once the word religion gets thrown in there, a lot of times that shouldn't really be our focus in terms of our working with clients, because it's making a difference what church you go to. If there's not going to be some good relationships with people, then it doesn't make any difference the dogma that they're getting. But this particular, you know, if there are some good relationships there, that can be very, very helpful.
Yes.
And so that whole thing is, to me, it's about the relationships. And you talk about spiritual journey. I suspect that a lot of people who've had success in the spiritual journey is because they've had people come alongside them that have enabled them. Somebody taught you Tai Chi, you know, and that person was probably not an abusive, exploitive person. It was a caring, loving person. So whenever I heard that word religion, I always kind of go to the relationship. Because in my own experience, you know, Jesus Christ is a healer, and he does that. But you don't get that from the church. You don't get that from the pastor. You don't get it from fire and brimstone. You get it from a relationship, a personal relationship. And so
Right.
sometimes some of the worst promoters of religion are extremely religious people.
Yep. And I think it's important to know, I mean, we've had a rabbi and a minister talk today. Up in Northern California, we had the Cecil Williams. Cecil Williams? Is that right? What? Cecil, okay. And I know when I worked at the San Francisco VA, that was a real resource for many of the patients there. And I felt very comfortable in, you know, when clients would bring up, you know, wanting to participate in the 12-step program. These were dual diagnosis patients, but they, you know, if they went to if they just looked at the addresses and they went downtown, they could end up in a 12-step group with a lot of people with jackets and ties from the financial district, and they wouldn't feel comfortable and they wouldn't be really made to feel at home. But if they went to Glide Memorial, they would not only be made to feel at home, they could get a meal, they could listen to that incredible choir they have. I had 2 patients who participated in the choir. It really offers that opportunity for a community. Yes, please.
Can I just make an announcement? They wanted us to announce this right away, that anyone who has a gray BMW license plate QEDULCE is parked illegally. And please move it. Sorry.
My other car's a BMW. I think we have time for one more. As a launch of it, we'll be circulating it much more widely. I have a number of my articles on my website and other links to many other resources. I think we've hit a quarter after. Thank you for your attention. Do you want to make an announcement?